Welcome back to 388 Days. My name is Chris.
And I'm Stephanie.
Today we wanted to talk to you about healthcare, specifically healthcare for full-time travelers like ourselves. Now, when we're traveling from country to country, we have to think about things like dental hygiene and physical exams on occasion. So this year we're in Southeast Asia, traveling through Thailand, Malaysia. We usually start by thinking about dental hygiene because that's something we know we need to do frequently.
Since we started traveling about 2 years ago, we've had dental exams in, 5 countries now. Chris had one in the UK. I had already had one right before we left. Montenegro, France, Thailand, and here in Kuala Lumpur. So that's 5, Malaysia, 5 countries. Overall, excellent quality, excellent level of care. I think all but one of the cleanings and exams was done by the actual dentist, which is very unusual in the United States to have happen. Usually it's done by just hygienists. And I think the most unusual thing for us to see was in France. We had x-rays, the whole thing done, and the dentist at the end said, "Oh, do you want me to email you your x-rays?" And we just kind of looked at each other because in the United States, the dentists hang on to your x-rays. But the French doctor was like, well, they're yours. What am I going to do with them? And so he emailed us our dental x-rays, which has actually come in handy since we've gotten them. But it was really unusual. But don't be afraid to go to a foreign dentist. Get recommendations from other travelers if you can get them, and reviews online work. That's how we've found ours, and we've been really happy.
Yeah, we usually use Google for that, Google Maps specifically, and we've been very pleased with the dentists that we visited.
Yeah.
They've all been very, very high quality and usually pretty easy to figure out whether they can speak English or not. I think it was most difficult, surprisingly, in France to schedule an appointment, but I think that was also because it was in August and everybody was on vacation, which we didn't realize until after we arrived and people were getting back from vacation.
If you're at all familiar with the U.S. healthcare system, then you know that dental exams and visits can be quite costly depending on what you have done. We were really pleasantly surprised that our costs on average were probably about $50 combined for the both of us for exams, including visits from the actual dentist and x-rays. I think it ranged from about $30 for the both of us up to $100 when Chris had his exam in the UK. So overall, very affordable.
So next up, let's talk about physical exams. That's a little bit more involved and maybe a little bit trickier than a dental exam or a dental cleaning. It's been about 2 years since we last had physical exams, and we started to think about where should we have our next one done. We were planning for perhaps 2025, but as we were starting to pass through Malaysia, we realized that Kuala Lumpur had some very, very high quality medical facilities here. And so we started exploring options, and there are actually several large facilities in the city that offer pretty high quality healthcare. We decided to go to a facility called Prince Court Medical Center, primarily because it was just closest in proximity to where we're staying. I think any of the other facilities would have been great. And we signed up for a couple of healthcare screening packages that were very, very comprehensive. So we wanted to get something that would give us sort of an overall general fitness, health feedback. And these plans actually were more comprehensive than I think we were expecting.
Much more, actually.
We thought that that would be a good thing for us to do, and they were very, very reasonably priced.
Yeah.
We've got some notes here, but all told, for the two of us, we spent $755 for both of our exams. Now, once we go through all of the details, you'll see it's quite comprehensive, and we thought the price was quite reasonable and very, very high quality. We started out the morning very early. We actually had to do a fasting glucose test, so we wanted to start early so we didn't get too hangry during the day. These tests are basically scheduled to go pretty much the entire day, and we were there for most of the entire day. So we started out in the lobby. We found the health screening area. It's a very, very nice building. Checked in, and I would say within maybe 5-10 minutes, we were called in to the back room where we started to go through the medical evaluation process.
And it's really interesting the way they have it set up. I hate to say it, it almost feels like you're in an assembly line, and in a way you kind of are, because you go from station to station to station, and the person who is there that's what they do. So when you go to get your blood work done, you're going to see a phlebotomist, and they know what they're doing, and they're quick and they're efficient. And every place we went, that's what it was. The doctors and technicians we saw were all expert in their field, and it really made things go smoothly, and you could ask questions.
Yeah, this is a big medical center with lots of specialists. They have pretty much any type of specialty you can think of here.
So we started off with just vital things that they do: your blood pressure, your pulse, temperature, weight. We got a hearing test, which was very reminiscent of hearing tests from elementary school in the United States, if you know what that is. And then something interesting, we got a resting EKG, which I don't think I've ever had done before. And then we followed that up with a treadmill stress test, which again, I have never had done. So you're running on the treadmill, or attempting to run on the treadmill if you're me, with the blood pressure cuff, and didn't last too long, about 6 to 10 minutes, something like that. And then we moved on.
Yeah, and that test was actually designed to test for heart health and potential blockages in your arteries. So I'd never had one done either, but after they explained this later in the day to me, I thought, oh, that's kind of cool.
Yeah. So after the stress test, we got our blood work done, and then we went to see our respective doctors. And there's a male doctor and a female doctor, and, you know, being a very conservative country where we are in Malaysia, they had, you know, separate male-female doctors, which I actually appreciated. And then we had a physical exam with the doctor, answered a couple of questions, and then it was off to the chest x-ray. Again, very interesting. Never had one done before, but it was all very quick, really easy to have done. And then this, especially I think for women, it's important to have done, but for anybody really, we got bone density screenings, which was very interesting, which I think was, just felt like a bunch of x-rays. I don't know exactly how they did it. But that was kind of cool to have that be included in all of this.
Yeah, and from what I've heard, those can actually be quite difficult to get in the US because they're expensive and insurance doesn't always cover them. So that was something we were pleasantly surprised to get. And I was kind of surprised that they offered one for men as well, just part of the standard screening. So that was kind of nice for us to go through. Yeah.
And the thing with all of this is it's based on preventative care. You know, talking about the bone density screening, I think in the US, I don't think they're generally offered by just as preventative care. It's more like, oh, we think there could be something wrong, or your age, your health, something, then the doctor will order a test. It's not part of any preventative care, which all of this that we got done was based on preventative care. Mm-hmm. So after the bone density screening, we got ultrasounds, abdominal and pelvic ultrasounds done, which again was interesting. Kind of goopy for all the stuff they have to put on you, which was kind of gross, kind of slimy if you've ever had an ultrasound. But it was good. The doctor was very efficient. He took his time. I never felt rushed during the entire day, and we were there for quite a long time. And that's kind of nice. And then after the ultrasound, we got an eye test done, which I thought was a little surprising. But
this was like a full eye exam that you would get from an ophthalmologist. Wasn't a vision test, although we did get a vision test earlier in the day. One of the things that we've noticed outside of the US is stores where you would go for eyeglasses, they usually don't have an ophthalmologist. They just check your vision and get you glasses, get you sorted with glasses. So to actually get, an ophthalmic an eye exam, you have to go to an actual doctor. Typically, it's going to be in a medical facility to get that done.
Yeah. So one thing that I really appreciated about Prince Court is with the packages they offer, they say, okay, you could be there, 6-7 hours. You have your testing in the morning, results in the afternoon, and they provided vouchers to have lunch. They have a couple options for dining within the medical facility, and we got our vouchers. When they said, you're done with the morning, go get some lunch, we did, went back, and of course, after we eat is when we met with the dietitian.
After lunch, they had the majority of our test results. So they did all the blood work, they did all the analysis on the x-rays, the ultrasound, what else, the bone density scan. And first off, we met with the dietitian, and she just went through some recommendations, kind of general guidance on food and healthy eating, but overall some good recommendations. I think we took away some valuable lessons in terms of foods that we can get here in Malaysia that we might not necessarily see in the United States that were healthy. Some of the leafy greens that we see in stores, we don't know what they are. So that was actually more helpful than we had expected. And then after that, we moved on to meeting with our doctors, right?
Yeah, the doctors, again, separately, went over all of our test results with us and, went over any questions we might have had or any concerns. If there were health concerns on their end, what we could do to address them, since this was all done in preventative care. And it was really, really good, very professional. They've got a really good program there. So at the end of the exam, I asked the doctor, can we get these results emailed to us? How can we get these results? And she said, oh, no, my assistant will give it to you. And we each got these lovely packets with all of our test results, including the actual printout of the EKG, which I think is hilarious. The bone density scans, very colorful actually, the eye screening, everything. And we also got it on CD discs, a 2-disc version of our health screening included in the package.
Yeah, I would have preferred if we somehow were able to get it in a different electronic format. We're going to have to figure out how to manage this paperwork. We may scan it in. Since we don't actually have optical readers, we're not sure what we're going to do with the CDs that we have, but we'll figure something out.
Yeah.
It was. I thought overall it was really nice. They did very, very comprehensive blood work, a lot of diagnostic blood work that you wouldn't see done in the United States. For us, everything turned out healthy, normal, so we were pretty happy with that. And as I said at the beginning of the video, all of these tests for the two of us combined was $755, and that included the free lunch, plus they have coffee and snacks. So
Snacks are always important.
yes. I think we were there 8 or 9 hours, so it was a pretty
Yeah.
long day. A little bit of waiting at the end, waiting around for to see the doctors, but
It was in a very comfortable
Yeah.
lounge, very relaxing. That's where the coffee and snacks were. So overall, really enjoyable experience. I mean, if you're going to get poked and prodded, they do it right, I guess.
After that, we scheduled an appointment with a dermatologist because we both wanted to have a full skin analysis evaluation by a dermatologist. We came back a week later.
Yeah, about a week later, we were able to get in, saw the dermatologist. He was very thorough.
Yeah.
Very thorough. I'm glad to say everything was fine.
So I thought the dermatologist's bedside manner wasn't as good as the doctor I visited when I did the health screening. But overall, I was pleased with the outcome. We we got what we came for. The dermatologist was quite a bit more expensive than our health screening, so I think we paid about $61 each to see the dermatologist. But again, we thought it was well worth it. We would have paid significantly more for the same services in the United States. So all in all, we were very, very pleased. It fit well within our budget for healthcare expenses. And we definitely would come back and recommend Prince Court if you're in Kuala Lumpur and you're looking for health screenings. We're going to continue to do this as we travel around the globe, trying to find the best places for healthcare services. Right now we're thinking that Thailand is pretty good. Kuala Lumpur, again, surprised us, but we were very, very pleased. And we're also considering looking at Turkey as a place where we can get affordable healthcare. Specifically for us, it's going to be things like dental care and health screening exams.
Yeah. I didn't realize how much medical tourism there was around the world until we started traveling. We had no reason to even necessarily know about it with the healthcare we got at home. We'd be really interested in your stories and feedback about where you've been able to get good medical care when you've been traveling. So please leave a comment below. Thanks for watching our video. If you liked it, please give us a thumbs up and consider subscribing. It really helps us get our stories and message out to other viewers. And we will see you in the next